Hematology, a guide to blood and hemostasis. Blood is often described as the fluid of life, a complex living tissue responsible for a variety of functions essential to human survival. Its composition includes plasma and cellular components such as white blood cells, WBCs, red blood cells, RBCs, and platelets. Plasma, the light yellow liquid portion of blood, serves as a medium for carrying water, salts, and enzymes. Its primary function is to transport nutrients, hormones, and proteins throughout the body, while cells deposit their waste products there. Plasma consists of crucial components including antibodies, clotting factors, albumin, and fibrinogen, all vital for various physiological functions. White blood cells, our body's defense mechanism, act swiftly when germs invade by producing protective antibodies and directly attacking bacterial invaders. Their lifespan ranges from a few days to weeks, and their number increases in response to infection, a condition known as leukocytosis. Conversely, a decrease in their number is termed leukopenia. Red blood cells are central to oxygen transport, ferrying oxygen from the lungs to tissues while removing carbon dioxide. These cells are produced in the bone marrow, needing iron, vitamin B12, and folate for their formation. Hemoglobin, a bright red protein within RBCs, gives blood its distinct color and facilitates oxygen binding. RBCs typically live for 120 days before being dismantled in the spleen, liver, bone marrow, and lymph nodes. Iron from hemoglobin is recycled for new RBC production or transformed into bilirubin for elimination. Platelets, small cell fragments in blood, are crucial for clot formation. Released from the bone marrow, they circulate for 8 to 9 days. Their membrane, coated with glycoproteins, prevents adherence to non-injured vessels. However, in vascular injuries, they bind to fibrinogen and von Willebrand factor, VWF, facilitating clot formation. Conditions like thrombocytopenia, decreased platelet count, and thrombocytopenia, impaired platelet function, affect this process. Blood values can vary between sexes, with men generally having higher counts for RBCs, hemoglobin, and hematocrit. Hemostasis, the process of stopping bleeding, involves 5 stages: vasospasm, platelet plug formation, blood coagulation, clot retraction, and clot dissolution. Successful hemostasis depends on platelet production, VWF, and liver-generated clotting factors requiring vitamin K. Hypercoagulability, a state of excessive clotting risk, can result from increased platelet function or clotting system activity, often linked to conditions like atherosclerosis, diabetes, and immobility. Bleeding disorders may arise from platelet, clotting factor, or vessel integrity defects. Disseminated intravascular coagulation, DIC, characterized by simultaneous clotting and bleeding, can emerge from settings like obstetric conditions, infections, and trauma. Anemia, a deficiency of RBCs or hemoglobin, stems from various causes including excessive loss, increased destruction, or impaired production. Its manifestations often involve pallor, weakness, fatigue, and compensatory responses like tachycardia. Polycythemia, marked by increased RBC mass, can be relative, primary, or secondary. While relative forms from fluid loss, primary polycythemia vera results from bone marrow disease, and secondary arises from hypoxic conditions like heart and lung disease. Symptoms often relate to hypertension and impeded blood flow due to increased viscosity. This detailed overview encapsulates the complexities of blood, its components, and related disorders, emphasizing both its crucial role in health and the delicate balance required for proper physiological function.